It's a common refrain: relationships are hard work. Fights are normal and rough patches are par for the course. True as that may be, however, these platitudes can distract from legitimate causes for concern in one's social and romantic life, including signs that a relationship may have become, or always was, toxic. Here's what you need to know about toxic relationships, and how to tell if you're in one. What is a toxic relationship? Dr. Lillian Glass, a California-based communication and psychology expert who says she coined the term in her 1995 book Toxic People, defines a toxic relationship as any relationship between people who don't support each other, where there's conflict and one seeks to undermine the other, where there's competition, where there's disrespect and a lack of cohesiveness. While every relationship goes through ups and downs, Glass says a toxic relationship is consistently unpleasant and draining for the people in it, to the point that negative moments outweigh and outnumber the positive ones. Dr. Kristen Fuller, a California-based family medicine physician who specializes in mental health, adds that toxic relationships are mentally, emotionally and possibly even physically damaging to one or both participants. And these relationships don't have to be romantic. Glass says friendly, familial and professional relationships can all be toxic as well. What makes a relationship toxic? Fuller says people who consistently undermine or cause harm to a partner, whether intentionally or not, often have a reason for their behavior, even if it's subconscious. Maybe they were in a toxic relationship, either romantically or as a child. Maybe they didn't have the most supportive, loving upbringing, Fuller says. They could have been bullied in school. They could be suffering from an undiagnosed mental health disorder, such as depression or anxiety or bipolar disorder, an eating disorder, any form of trauma. What are the warning signs of a toxic relationship? The most serious warning signs include any form of violence, abuse or harassment, which should be dealt with immediately. But in many cases, the indicators of a toxic relationship are much more subtle. The first, and simplest, is persistent unhappiness, Glass says. If a relationship stops bringing joy, and instead consistently makes you feel sad, angry, anxious or resigned, like you've sold out, it may be toxic, Glass says. You may also find yourself envious of happy couples. Fuller says negative shifts in your mental health, personality or self-esteem are all red flags, too. These changes could range from clinically diagnosable conditions, such as depression, anxiety or eating disorders, to constantly feeling nervous or uncomfortable, especially around your partner. Feeling like you can't talk with or voice concerns to your significant other is another sign that something is amiss, Fuller says. You should also look out for changes in your other relationships, or in the ways you spend your free time, Fuller says. You may feel bad for doing things on your own time, because you feel like you have to attend to your partner all the time, she says. You cross the line when you're not your individual self anymore and you're giving everything to your partner. Finally, Fuller says concern from family or friends should be taken seriously, particularly since people in toxic relationships are often the last to realize it. Brock says that was true of her relationships, which perpetuated the damage for years. By the time I actually started realizing I was in something that wasn't healthy, it was so normal to me that it didn't seem like that big a deal, Brock says. You get paralyzed in it, because you're just used to it. If any of those red flags sound familiar, it's time to take action. If you feel that you're in physical danger, you may need to involve the authorities. The National Domestic Violence Hotline is also available for 24/7 guidance at 1-800-799-7233. If the harm is emotional or mental, you'll have to decide if it's possible to work through the issue. If underlying triggers such as depression or trauma are influencing one or both individuals' behaviors, Fuller says therapeutic or medical treatments may help. Glass agrees that getting to the root of the problem is important, but says that sometimes, the answer may be to walk away. Named after the infamously uninhabitable ghost town of northern Ukraine, Chernobyl Toxicity Syndrome, CTS, is the unofficial diagnosis meant to help patients learn how physical manifestation of one's debilitating illnesses are most frequently found in a person who was exposed to someone believed to be so mentally and emotionally exhausting, that those conditioned to this person would later become afflicted with one or more life-altering, if not terminal, disease and/or physical illnesses. Much like radiation poisoning, toxic relationships, whether domestic or at a distance, are extremely harmful to our overall well-being, which gives reason for concern the more common it becomes. Sociopathic behavior from these toxic individuals around them increase levels of stress, anxiety, depression or even suicidal thoughts, and as a result of the mostly covert, but nonetheless extremely dangerous manipulation, their emotional pain is so immovable that it eventually forms an equally immobilizing physical presence, often targeting vital organs. This toxicity is caused by frequent association with someone who is in lack of moral values and are prone to endangering the lives of others due to their egoic mind and extreme lack of conscience. Clinical studies have reported that stress from long periods of trauma or traumatic experiences contribute to poor health, which increases our risk of all kinds of illnesses, from autoimmune diseases to cancer. Chernobyl Toxicity Syndrome is a shared symptomatic response indicative to trauma from any number of mental illnesses or psychological impairment that had to be present for extended periods of time. This type of toxicity takes effect given the involvement with those who have either been diagnosed with or shown evidence of genuine psychopathology, but most commonly associated with NPD, narcissistic personality disorder. The behavioral makeup of this particular mental illness is so difficult for those suffering from CTS to comprehend, much less associate with their deteriorating physical health, that if not determined sooner, if someone showing signs of CTS remain unaware of their toxic environment, they will start to show symptoms of one or more severe illnesses similar to the exposure of radiation poisoning. It is the unfortunate aftermath of any long-standing relation with a person or a group of people who use covert manipulation such as, but not limited to, gaslighting or gangstalking that are usually deliberate and vindictive to those who suffer from CTS.
You know what? Fuck it. Nobody gives a fuck about me,